See, you didn't mess up, I did. It's time now for Business Spotlight, brought to you by Morris Hospital and Healthcare Centers. I'm Leanne Oliver, and today our guest is Belal Saeed, rheumatologist with Shanahan Healthcare Center of Morris Hospital. Good morning, Dr. Saeed, and welcome.
Good morning, thank you.
How are you this morning?
Yeah, great, good.
Dr. Saeed officially joined Morris Hospital Thursday, December 8th, and you're going to begin seeing patients Tuesday, December 13th at the Shanahan Healthcare Center of Morris Hospital, and they're located at 25259 Reed Street in Shanahan. Dr. Saeed, what is the role of a rheumatologist, and what types of conditions do you treat?
Well, rheumatologists usually treat and manage and diagnose autoimmune, inflammatory, arthritis, and musculoskeletal conditions, and in general rheumatic diseases that affects the joints and involve some other parts of the system sometimes.
Tell us a little bit about yourself. How did you come from, you're originally from Jordan, how did you come to Morris?
Well, I was raised in Jordan. I went to medical school in Jordan, and I did my training in St. Vincent Hospital in Connecticut for internal medicine residency. Then I went to New York for 2 years of fellowship in rheumatology at Columbia Medical Center. Then I practiced 5 years at Eastern Kentucky. Then right now I'm moving to Morris, Illinois to join Morris Hospital.
Which we're very, very glad to have you here.
Thank you.
Why did you decide to become a rheumatologist?
Well, I decided to become a rheumatologist. Mainly, I decided to become a physician as I grew up and watching my two uncles who had suffered from rare neurological disease that took their lives when they were in their 30s. So I decided to go into medicine and try to understand why and what happened and understand how the system works and how the body works. So I decided to go into medicine, and after I did my medicine residency, I have been exposed to multiple patients with rheumatic disease who still suffer from unresolved issues, and we don't understand their causes for their arthritis, so I decided to specialize in rheumatology.
Now, rheumatology, I know, can really be devastating for a lot of people because of what it does to the joints and moving and everything. What kind of relationship do you try to establish with the patients and the families when you have someone coming in and they think they might have an arthritic disease?
As you know, rheumatological problems are mostly chronic conditions, and I try always to establish a long-lasting relationship with the patients based on trust and respect, because we have to work together to improve their quality of life.
When would you think that someone should come in and see a rheumatologist?
Anyone has symptoms related to joints, let's say joint pain, swelling, redness in the joints, stiffness in the morning when they wake up, that lasts for more than 2-3 weeks, and I think they should see a rheumatologist. Sometimes it's difficult to point to the symptoms, and they have to look for other symptoms also beside the joint symptoms like fever, weight loss, skin rash, things like that.
Now, you're going to be seeing new patients. Does someone need to be referred to you, or can they just call for an appointment?
I do prefer that patients will be referred to me so we can work together, me and the patient and their primary care provider, to improve their health.
Dr. Saeed will be at Shanahan Healthcare Center of Morris Hospital. They are located at 25259 Reed Street in Shanahan, and that phone number is 815-467-0555. Again, we would like to welcome Dr. Saeed to Morris. Thank you, Dr. Saeed, for being with us this morning.
Thank you so much, and thanks for Morris Hospital.
You've been listening to Business Spotlight, brought to you each Friday morning at this same time by Morris Hospital and Healthcare Centers. I'm Leanne Oliver. Have a great day, everyone.